Will these prednisone side effects eventually recover? When will I feel like myself again? Many people taking prednisone want to know this, and a prednisone warrior named Chloe recently reached out to me with an email asking when she's going to recover from the side effects she personally experienced from prednisone. So I'm going to read her email so you can understand the context, and then I will reply to that with the principles of how prednisone recovery works, which side effects go away, when they might be going away, and what to expect. So this is what Chloe says. Dear Dr. Megan, I hope this message finds you well. My name is Chloe, and I am a 20-year-old woman who's recently experienced fill in the blank diagnosis. I was prescribed methylprednisolone 24 milligrams per day for 1 week, followed by 1 week of tapering. After this, my symptoms returned and it worsened. As a result, my doctor increased my dosage to 48 milligrams per day for another week, followed by tapering for a second week, completing a total of 4 weeks of steroid treatment. 2 weeks after finishing the steroid regimen, my ear-related symptoms have improved, but I am now noticing side effects from the steroids. Specifically, I have visible veins, particularly in areas with thin skin, frequent bruising on my legs, and red spots scattered around my body. At times, I experience unexplained pain in my knees and elbows, and I've also developed floaters in my vision. I believe these symptoms are side effects of the steroids, but when I expressed my concerns to my ENT doctor, they dismissed my symptoms, which left me feeling disheartened and frustrated. Dr. Megan, I am desperately seeking your advice. Will these side effects eventually recover? I am terrified every day, and I deeply regret taking the steroids. If you could kindly offer any guidance or reassurance that there is a possibility for recovery from these side effects, it would mean the world to me and give me hope for the future. Thank you so much for reading my message, and I would be incredibly grateful for any advice or support you could provide. So with steroid treatment, the number one goal is to have it work, right? And it sounded like that shorter term treatment wasn't enough. So after 4 weeks, she finally got the benefit that she needed in making her original disease symptoms go away. Now, 2 weeks after stopping treatment, she's having side effects that she's attributing to her treatment with methylprednisolone, which is pretty similar to prednisone. So I may use those terms interchangeably. So the main question is, will these side effects eventually recover? And for most side effects to steroids like prednisone and methylprednisolone, yes, you will eventually recover. There are a few permanent irreversible side effects that I will talk to you about at the end, but for most side effects, they do go away. And I wanted to talk about her side effects specifically because the question kind of is, first, are these actually side effects of the steroids? And then two, when will they go away? Because it sounds like the way the doctor, the ENT, treated her, it made her feel like she was being gaslighted, that what she wasn't experiencing was real. And so let's address that concern first. So I created the ultimate list of prednisone side effects. And you can find this on my website, prednisonepharmacist.com. And the list I compiled from many different sources because there is no complete full list aside from mine. And different sources, whether it's Micromedics, Lexicomp, UpToDate, or other resources that doctors can look at, actually have different lists. They're not the same information. And so if a doctor is looking at one list and another doctor is looking at a different list, they're going to share different information to you about what to expect. And their source of belief, their source of knowledge is actually different, unfortunately. And why would that be? Probably because prednisone is a super old drug that was approved before the FDA required side effect studies of the manufacturers. And so the lists of side effects we have are inaccurate and incomplete. So with all that said, is frequent bruising on my legs, visible veins where there's thin skin, red spots scattered about my body, are these actual side effects of prednisone? Are these legitimate? Or is she just making this up? Or is this some other disease appearing? While it is possible that it is some other disease appearing, for example, the bruises that I'm assuming don't hurt. They are probably bruises that are actually bleeding under the skin that are called ecchymoses, ECCHYMOSES, that can be a sign of a bleeding disorder, as can the red spots, which are actually called petechiae, which are the symptoms I had when I was diagnosed with my autoimmune disease, ITP. So you always want to rule out an actual other disease before you attribute it to a drug. So if it were me, I would make sure you get your blood tested, specifically your CBC, complete blood cell count, because you want to make sure you have enough platelets, which is my problem. That's why I had to take prednisone. It's because I did not have enough platelets. My body was killing them and I was bleeding under my skin. And that's what the bruises and red spots were. It's actually bleeding. So you want to rule that out. But with that said, prednisone itself can cause these symptoms. They are legitimate side effects noted in at least 4, if not 5 different sources. So those are totally legitimate. As far as seeing veins and thin skin, prednisone and steroids in general are well known as thinning skin, as breaking down the collagen that provides the thickness and elasticity of skin. And so that is definitely a normal thing that can happen. As far as, are these going to go away, especially the collagen related issues in the skin, if it had progressed further to become stretch marks. So if the collagen had not just thinned, but actually pulled apart, leaving stretch marks, that's permanent. That's irreversible. There's nothing you can do about it. It leaves red striae, is what they're called, stretch marks that don't go away. They might fade, but the stretch marks, that damage to the skin is permanent. Just like when I was pregnant with my babies and my skin stretched to fit them, that stretch mark isn't going anywhere. It's permanent damage to my skin. I love my babies. I'm sad about the damage to my skin, right? Just like I love the fact that I was able to take prednisone, I'm sad about potential damage it could cause. So luckily, you haven't reported that symptom. So I hope that isn't one you're experiencing. The thinness of skin usually returns. People often apply topical steroids to places where they have a rash on like hands or elbows or face somewhere, and it will thin out the skin, and it can actually, like tear the skin eventually if there's too much collagen depletion and damage. But it sounds like in your situation, it hasn't gone that far. And so it usually does return, right? It hasn't progressed to the level of permanent damage. Okay. Then you also mentioned unexplained pain in my knees and elbows. And I've also developed floaters. So let's talk about the pain. So going off of a steroid like methylprednisolone can lead to what's called withdrawal symptoms. And often withdrawal, like your body got used to being on something and now you've taken it away, whether it's alcohol or another kind of drug or methylprednisolone, your body gets used to it. And sometimes one of the symptoms of withdrawal is joint pain, like elbow and knee pain. And it can be pretty miserable, but eventually it does go away. If it isn't going away, possibly going back on the lowest effective dose where you weren't feeling that, and then staying on it for a longer time and tapering slower off of it could potentially be a way to deal with it, but it might go away on its own. It should go away. And then the floaters in my vision. Now that one's a little different. I'm not sure if that is a prednisone side effect or not, or a methylprednisolone side effect or not. Prednisone does do at least 3 things to people's vision. It often causes blurry vision, and that goes away. It can cause cataracts, that doesn't go away, and it can cause glaucoma, and that doesn't go away. Those are more likely when people are using eye drops with steroids in them. So it's less likely that a 20-year-old with only 4 weeks of treatment is getting these old age eye complications, but it is possible. If you are concerned about the eye side effects, definitely make an appointment with your eye doctor. Like, that's something I recommend for most people taking steroids. So if you're actually having this, do it. Take the precautions you need. Get your eyes checked. Make sure they check the pressure. Make sure they're checking for those floaters, and they can answer that question. So floaters could be a symptom of something else. I'm not an eye doctor. I don't actually know for sure about that. It's not a typical side effect of prednisone. So in general, I am trying to offer guidance and reassurance as you asked, and there is a possibility of recovery from these side effects. You didn't mention any of these long-term, permanent, irreversible side effects as something you're experiencing, but just for completeness, I'm going to tell you what they are. If you were to have heart complications, for example, you had heart disease progression, whether it was an arrhythmia or a heart attack or stroke, that's irreversible. That damage to your heart happened and there's nothing you can do about it. But if you're 20 years old, you probably had no heart complications and you're probably just fine. Withdrawal of bone strength and mass leading to osteoporosis. That bone loss is irreversible. Once it's gone, it's gone. There's nothing you can do about it. And then I already mentioned the eyes. So it's the heart, the bones, and the eyes, and then stretch marks. Those are the main permanent irreversible side effects that you can do nothing about. But actually, none of those have affected you. So everything that has happened to you should be irreversible if it was truly caused by prednisone. So if I were you, I would get a blood test to make sure that your blood is okay, and I would make an appointment with an eye doctor. Make sure that you're following up with all of these possible complications if you're still concerned about them. All right, signing off as Dr. Megan, your prednisone pharmacist.